more it sounds like you've got a chest infection. Do you mind if I have a listen to your chest with my stethoscope?
So how come you were listening to my back when you were trying to listen to the lungs?
Listening at the back does give me a little bit more information because the lungs are actually situated more towards the back of the chest. Listening to the front of the chest is not a bad way, but I prefer to listen to the back. The stethoscope is such a tool that allows you to amplify sounds of the anatomy. So I can listen to your chest, any wheeze, any signs of crepitations, which are signs of infection. I can listen to the heart sounds, especially the valves as they open and shut. I can also listen to any bruits, and I can also listen to abdominal sounds. So really vital piece of kit, and be sure to be confident in using it.